You know, when a CEO usually stands at the podium and talk about facility renovation, everybody probably would think, oh my God, I'm going to see a very flashy corner office, and I'll probably see one of those espresso machines and a parking spot designated for the CEO. But guess what? You're not going to see any of these today. I guarantee you. But I might have to have a conversation with Chris about this. All right, there you go. But in all honesty, this renovation that we did here at the site is way much more than a cosmetic facelift. It renews our promise to Berks County and surrounding area. It renews our commitment to the community that we serve and expand on our mission to save lives in the community that we service. What we did here is to make sure that we have a space for our staff to do what they do best and to have a safe space for our donors every time they walk in to donate the blood and save lives. My name is Rami Lima, and as President and CEO of Miller-Keystone Blood Center, it is my honor to welcome all of you to this site that is designed for our community, built for our mission, and dedicated to save lives in Berks County. To kick off, I would like to extend a great, huge thank you. Yes, Madison, now it's your turn. I would like to say a thank you to Congressman Dan Muser and his South Region Field Director, Madison Caldo, for their kindness. They presented us with the American flag that was flown over our nation capital back in January in recognition of Miller-Keystone Blood Center. Thank you so much for the flag, and the flag is outside, already flying high, as a reminder to the service, community, and collaboration that gathered all of us today to make sure that we have the blood we need to support patients in the community that we serve. Madison, thank you so much. Let's give them a warm. And thank you for making the time to be here with us today. I would also like to acknowledge one of our board members, Dr. Thomas Gang from Tower Health. Thank you so much for being here with us today. We appreciate you being here, your support. And Dr. Gang is a blood donor as well, if you didn't know. So, as I mentioned earlier, the idea of this renovation is to renew our commitment to the community that we serve best. And I want you to bear with me. 60 years ago, to be exact, on September 6, 1966, Berks County Blood Bank started in this area. And then the name changed. It became Keystone Blood Bank. And in 2000, 2001, it became part of Miller. And we've been operating under that name since 2001, Miller-Keystone Blood Center. So today is a commitment. We are here to assure all of our community as Miller-Keystone, the only non-profit independent community blood center servicing our region hospitals. At this point, we are servicing 18 counties in the state of Pennsylvania. And we do need an average of 350 blood donors to show up to one of our collection sites or blood drives to be able to support all of the patients that we service. You probably already saw on the news or heard about the nationwide blood shortage. It was also in the news last week in one of our neighboring northeastern states, a woman with anemia condition needs blood transfusion every few weeks. She was denied blood transfusion. This happened last week in a neighboring state. A woman was denied blood transfusion because the hospital decided to keep that blood in case of emergencies and traumas. Think about it. I'm sure you don't want your neighbor to be in that situation. You don't want your kids to be in that situation. And of course, you don't need yourself to be in that situation. But this is reality. And that's what we do. Our region hospitals depends on Miller-Keystone Blood Center to make sure that the blood is available for those patients. And we depend on our blood donors to make it happen. So my message to you all, when you go back to work, when you go back home, talk to your neighbors, friends, children, students, encourage them to donate the blood. It takes an hour. If you truly think about this, how else can 60 minutes of your time, and if we're doing whole blood, it's every 8 weeks. 1 hour of your time every 8 weeks will have a positive impact on a random person, a stranger. You will be saving lives. You will be impacting families every time you donate blood. Every time you donate the blood, you're impacting a human being. There's a cancer patient waiting for that blood. There's a trauma patient waiting for that blood. A premature waiting for that blood. That's my message to you today. And back to our celebration, if you look around, you will notice that we did our best to make this site as efficient as possible to make sure that our staff has the environment to do what they do best, collect blood. And for our blood donors to feel safe, welcome, and hopefully to encourage them to donate more often, right? That's the key. So that's the marketing for today, right? Let's make sure we get our blood donors to donate more often. At this point, I would like to ask Dr. Gang to give a few words. Dr. Thomas is on our board, as I mentioned before, and he is the chief of surgery at Tower Health Reading Hospital. He doesn't like me to give all of his titles, but knowing him, I believe he's probably more proud of being introduced as a blood donor himself.
Thank you, Ronnie. Sorry about my voice, by the way. Before I start, I'd like to recognize Representative Weekneck, who is here and came after Ronnie started. I can't tell you how happy I am about this renovation. I've been giving blood for many years. I came out here a few times. Now I do them at the mobile blood drives down at the hospital about every 8 weeks. But I used to come out here, and while the people here were wonderful, the facility was a little dated, a little dark, and look how bright this is. It's beautiful. I'm chief medical officer, I'm chair of surgery and all those things, but first and foremost, I'm a trauma surgeon. And I have to tell you that I was just on call Thursday night, and we had a critical patient come in that required multiple units of blood, whole blood, in addition to packed red blood cells and platelets. So I see, pretty regularly every time I have a bleeding trauma patient come in, the benefit of the wonderful generosity of our donors. And now that they have this wonderful place to come to donate to, and also at the hospital, I have to sort of recognize my colleagues at Tower and Reading Hospital. Just about a month or two ago, and we put out a call for help, and literally within hours, 2 emergency blood drives from the mobile unit filled up within hours. With people who work at the hospital who just said, you know what, we're going to pitch in and we're going to donate blood. So, thanks for having me here. I love what I do. First and foremost, I'm a trauma surgeon before all else, but love being on the board at Miller-Keystone. I was asked several years ago, and of course said absolutely, and whatever impact I can have on the community by doing this, it warms my heart. So thank you for coming and for helping us reopen this center. It's just a wonderful event.
Thank you.
Thank you, Dr. Dent.
So now I think we're going to go outside to do the official ceremony. All right, so if you'd like to meet us outside, let's do it.
You ready?
We're ready.
We're ready when you are.
All right.
Yay!